Hello friend, welcome to the channel Pharmacy Dictionary. In today's lecture, we are going to see about another route of drug administration under systemic route, that is parenteral route, and we have to see their basic advantage and few limitations along with their demonstration. So what is the meaning of parenteral? If we bifurcate this word, we can have two meaningful words. These are par, that means beyond, because we have paranormal activity. Par from that activity, that means beyond, and the second one is enteral, that stands for intestine. So any of the route of drug administration that beyonds of the oral route of administration that will go through the intestine, it is simply known as a parenteral. That means apart from intestinal route, that is simply considered as a parenteral route of drug administration. And under this parenteral route of drug administration, the most important routes are subcutaneous, intravenous and intramuscular route of drug administration. But in this video, our all topic will be concerned only about the intravenous route of drug administration. So what are the intravenous route of drug administration? Again, same principle we have to apply. Intra means inside and venous stand for veins, because two types of blood vessels are present in our body, arteries and vein. So we have to produce the effect of drug by injecting it inside the vein or any body fluid, that is called intravenous route of drug administration. So in case of oral route of drug administration, we have seen that the drug has to go for the disintegration, dissolution, then only that will produce their desirable action, because ultimately also that is the example of systemic route of drug administration, and this is also example of systemic route of drug administration. But the difference between these two are that in that case of oral route, that have to go for different pathways, then only that will reach to the blood or for our parenteral route of administration. But in case of parenteral route, the drug is directly injected into the blood, so it has not to go for any type of disintegration, dissolution or absorption. That will produce its effect directly, because the drug is going into the blood directly. This is the basic concept. That is why, because of this phenomena, because of this advantage, that drug is a choice in case of emergency situation. So let's continue with the further points. The next one say administration of drug by injection directly into tissue fluid or blood. So this is an important line regarding this route of drug administration. How we can introduce any drug inside the blood? This is needle and syringe. You have seen it so many times. So with the help of syringe and needle, we have to take the medicine and then inject it to a blood. So this is a different types of drug medicament. This is amikacin, which is used for the antibiotic purpose, for the treatment of infection point of view. So after tearing this cap, we have to take the particular amount of drug in this injection with the help of syringe, and with the help of needle and syringe both, we have to introduce that drug inside the vein. That was the actual meaning of parenteral, apart from intestine that will reach to directly into the blood. Let me explain you with the help of this diagram. This is blood vessel. Suppose here it is vein. In this vein, a blood is moving along with different constituent of blood. That blood is moving from one part to the other one. Whenever we will inject the drug with the help of this needle and syringe, the drug which is presented in a blue dot will go or will flow along with the blood, and that will reach to the site of action and is and it will produce its desirable or undesirable, in short its pharmacological effect. That is a basic process or principle of parenteral route of drug administration with special reference to intravenous route. So coming to the next one, drug is given as, in case of intravenous route of drug administration, drug may be given by two main types. That first one say is bolus. Bolus means immediately large dose, that is also considered as a loading dose, is given. They are dissolved in a suitable volume of vehicle and injected slowly. The example of this bolus injection is heparin, which is example of anticoagulant. Now this paragraph has to be understood with the help of simple explanation and live demonstration. So first type of intravenous route of drug administration says bolus. That means in initial type, in starting of this process, we have to give a large dose, which is called as a loading dose. That loading dose or large dose means to start the activity of the particular drug. Initially, we have to give its dose as compared to the normal, that will be a little bit in a higher side. After that, we will have to maintain that particular dose, but initially that has to be given in a larger dose or loading dose. Is given, they are dissolved in a suitable volume of water or different water volume of different vehicles, so that they will be dissolved completely, and then that drug will be go slowly. That is not rapidly, then will be go slowly. Example of this is heparin. It is example of anticoagulant. That means any agent, any drug which is used to dissolve the clot which has been formed inside the blood vessel. This is called anticoagulant. Now let me explain you the exact meaning of this. I think you have used this kind of drip This is a different types of solution, and this is an example of multiple electrolyte and dextrose injection type 3, that is based on Indian Pharmacopoeia principle, that is IP. So if any person need to take this kind of large volume parenteral, he or she should give this drug slowly with a controlling unit. In the first case, the initial dose will be higher, so that's called loading dose. So this is our drug, and these are the different aids which are used to introduce the drug inside the body of patient. So this has to be inserted here, and to avoid different types of air bubble, we have to check it accordingly. Then any drug of interested is injected inside this bottle, so that the particular amount of drug will be dissolved in a proper amount of vehicle, and then this needle is inserted inside the vein of particular person in which you are intended to administer this kind of drug for the therapeutic activity. Now you can see this is the meter, that we can say controlling unit. As we push it down, that will be pressing activity. So the amount of, or we can say drop of drug along with this vehicle will go slowly, drop by drop. Whenever we turn it upside, that will be in a full force, that will fully force, that will be reached to the blood of particular person. So this was basic introduction regarding bolus route of drug administration. This was important, you have to keep this in mind. Next one, say slow injection over 15 to 20 minutes. That is example is amylophyllin, which is used for the treatment of congestion problem in lungs, different types of constriction problem of bronchia, that is used for relief of this kind of problem. So this is saying that 15 to 20 minutes is sufficient. Slowly we have to go with the help of different types of needles and syringe. It may be categorized as a large volume parenteral or small volume parenteral. This is example of large volume parenteral. The quantity of this packet is about 500 ml, and this is only about 1 to 2 ml, right? Yeah, it is 2 ml of quantity. So this is very small volume parenteral, and this is large volume parenteral. Why this is small volume, large volume and parenteral? Parenteral is common, that means that will be go to blood, into the blood directly, but quantity of this injection is very small, and this is very large, 500, and it is 2 ml just. So this is called difference between large volume parenteral and small volume parenteral. Coming to their basic advantages, to what advantages, in case of emergency, immediate pharmacological action can be produced or can be achieved by this route of drug administration, that means intravenous route of administration. So in your hand, you can see the different types of veins. So here I am pushing my finger, and you can see the veins. So we have to introduce that needle into the vein directly. That is very important process, and for that you have to know the exact location of veins, so that only you can administer the drug accordingly. In case of emergency, that produce faster effect. Unlike the other route of drug administration, any of the other route of drug administration apart from this intravenous cannot give you immediate effect. In case of oral, as you know, that has to go for disintegration and dissolution, and rest of others process have to followed by that route of drug administration. But here the drug is directly moving through the blood, and that moving from the blood along with different types of tissue, so that it will produce faster effect as compared to any of the other. This is major advantage. Second one says 100% bioavailability. Another important parameter you should keep in mind. Bioavailability means the rate and extent of drug absorbed from its dosage form and that reach to the systemic circulation is simply cause of bioavailability. This is important one. So in this case, the drug is directly going through the blood, directly injecting into the blood. So that is why 100% bioavailability can be achieved via this route of drug administration. And apart from this route, there are no route which will produce 100% bioavailability. So this is one other important point you have to keep in mind, because this question comes into a sessional examination. Next one, say large volume can be given. In case of intravenous, we can give this 500 ml of drug. So this is possible only in case of intravenous. How will you give intramuscular? How will you give a topical? This is not possible. So this is possible, but it means large volume drug can be given only through the intravenous route of drug administration. Next one, say mild irritative. That has to be remembered. Not exactly irritative, mild irritative drug. So mild irritative drugs can be given because that will be diluted into blood. It is not about the exact irritant. Mild irritative drug can be given because after giving into the blood, that blood will dilute that irritant substance and that will be lesser irritant. Already it is in mild. After some time that will be not irritative substance. So this can be given via this route of drug administration. The next one, say dose adjustment is possible, can reduce or can increase as per the need. As I have explained you, this with the help of these units we can control the dose. If you want to increase the drop per minute, you have to just pull this down. If you want to decrease the drop per minute, you have to adjust this roller ball accordingly. So you can control this route of drug admission. You can control the volume of admission too. The next one says the limitation. What are the basic limitation of this route of drug administration? First, once injected, then cannot be withdrawal. Unlike the oral route, if you have taken some wrong drug which has not to be taken, then suddenly you click, oh, I taken wrong drug, you can vomit it out. After some time, even after taking it inside, you can place your finger and you can vomit it out. That is possible with case of oral route of drug admission, but in case of intravenous route of drug admission, how it will be possible? How will you remove the drug from the blood, except in few cases of dialysis? So this is a limited advantage, or we can say this is a limitation actually. Next one says irritant may cause thrombophlebitis. Different drugs which are irritant in nature. Now let me clear, this is mild irritating, not exact irritant. But in case of exact irritation, the thrombophlebitis, that means the plaque formation, that's clot formation inside the blood vessel, specifically in your leg part. So that can be caused by this kind of drugs. The second one say only aqueous solution can be given through intravenous. You cannot give oily suspension, oily dosage form in intravenous route, because that may cause different problem like embolism, etc. Now next limitation say extravasation is possible in case of inflammation. In our main channel, that is solution pharmacy, we have explained different route of drug administration with their basic advantage and limitation too in Hindi, but that is in Hindi. But in case of inflammation, we have explained the process of extravasation. In that case, the movement of RBC or WBC comes through the blood vessels. This is possible in case of intravenous route of drug administration. Next limitation say oily drug or droplet drug cannot be given through, because they may cause droplet and embolus formation, and that will create a different types of problem inside the veins and inside the different tissues like brain and etc., where it will be moved through. The last one say self-medication or self-introduction is very difficult. Sometimes it is not possible. In case of subcutaneous like insulin injection, you can give it by yourself. In case of intramuscular, you may be give it by yourself. But in case of IV, it is little bit difficult. So this is not convenient route of drug administration if the person want to introduce the drug by himself or herself. So friend, this was a basic and small introduction regarding parenteral route of drug administration, or we can say intravenous route of drug administration. Thank you very much for watching this video. So reference for today's video is KT Tripathi only, as like the previous one. If you want to take the screenshot of this whiteboard section, you may have it after some time. So again, take care. Thank you very much for watching.